also have Dr. Vivek Nangia, the Principal Director and Head of Pulmonology of the Max Hospital here in Delhi. And also we have Mr. Vivek Chattopadhyay, the Senior Program Manager of CSE. Thank you so much and very good morning for joining us here on NDTV. Let me take my first question to Mr. Vivek Chattopadhyay. Arvind Kejriwal has also gone on to say that it was the least polluted as far as Choti Diwali is concerned at 259. But when we talk about Diwali and the morning after, we're seeing that the pollution is in the very poor category. If you can just compare how pollution has panned out on the day of Diwali and the morning after in the last few years.
See, like comparison of Diwali days, like it would definitely vary because it falls in October or November. So if the conditions are good, then the situation is like this time harvesting has begun, but thereafter it was obstructed by rains. So its contribution has remained low. However, it is picking up as at the same time Diwali happened and its contribution in the air quality is visible to everyone that how it has turned to very poor. And what we call very poor is actually hazardous or unhealthy, considering the international air quality indexes. So it's actually very unhealthy for the people to breathe. And we should keep in mind that what is the safe level? Safe level, according to our norms, is 60. And WHO is much tougher guidelines. So definitely we are breathing very hazardous air, and authorities might have taken action, but it is not showing up in the results in air quality. So I would say that the contribution of Delhiites or the people also become very important unless until they understand the implications of poor air quality, they are not cooperating. So that is a major concern. So mass awareness campaigns, behavioral changes are very important to inculcate those habits that what is polluted. We should not be part of the polluting activities. On what ground now we will blame the farmers? If the urban people themselves could not take care of their own air quality, I would say.
Right. So there, Mr. Chattopadhyay highlighting that we are indeed breathing toxic air and a mass behavioral change is needed in order for us to actually see some sort of improvement. I'd like to take my next question to Dr. Nangia. Dr. Nangia, did you get any sleep last night, and how upset were you that the firecrackers were invading your privacy?
So I think most people lost their sleep last night because of the noise initially. And then, of course, it's going to be the pollution which is going to affect us in the days to come. See, there are certain facts that we all need to remember that in 2012, 7 million deaths globally were attributable to air pollution. That means 1 in 8 deaths were due to air pollution. This number rose to 9 million deaths in 2015. And in 2019, 1.7 million deaths in India alone were attributable to air pollution. So that is a kind of quantum of impact that the air pollution has on our health. So if we are not careful, then I think it's only going to worsen. Especially there are these 6 patakas that we usually burst during Diwali, which include the snake, the fuljadi, the anar, the phirki, the ladi. They all emit 200 to 2000 times higher particulate matter than what is permissible by WHO. The problem is that the quality is also so poor that it is only going to worsen the air pollution in our cities, in our country. So I think we should have been a little more careful with as far as bursting the firecrackers is concerned on Diwali this time.
But Dr. Nangia, irrespective of the fact that we had a firecracker ban in Delhi, we still heard all that we heard last night. What do you suggest is the correct way forward at this stage? Delhi has been facing persistent pollution for about 2 decades now.
Yeah, exactly. I think we need to work out some long-term plans to control the air pollution in our city. While that is happening, there are certain measures that we as individuals should be taking at our own level. First of all, we all need to quit smoking if we are doing that still, because as it is, we are breathing such toxic air. On top of that, if you're smoking cigarettes, cigars, hookahs, then you're only damaging yourselves and creating problems for yourselves for times to come. Second is we should have more of plants, trees, greenery around us. Third is we also need to control the indoor air environment. It is not just the outdoor air pollution that is causing a problem, but the indoor air pollution is also causing a significant kind of damage to our lungs. So we need to take care of that as well. Fourth is, of course, vehicular emissions. So this is a time where we need to go in for things like carpooling and, odd and even numbers probably that may also happen in times to come if the situation worsens. And then, of course, we need to think how we can do, how can we control the air pollution further, whether spraying of water will help or anything else that needs to be done. But yes, what we need to do is for sure that I guess the time has come where we need to decide our activities, outdoor activities, based on the AQI levels. So people who are vulnerable, like those who have asthma, heart disease, any kind of lung disease like chronic obstructive pulmonary disease or interstitial lung disease, if the AQI level is between 100 to 200, they should not be exercising outdoors. They should not be performing any kind of strenuous physical activity outdoors. If it is above 200, then they should completely restrict their movement outdoors. Whereas for normal individuals, I guess the cutoff would be around 200, where if the AQI is more than 200, then they should avoid strenuous physical activities. And if it is above 300, then nobody should actually be moving out at all at that time. If at all you have to, then the only way is by wearing masks, the N95 masks, which will protect you to some extent from the particulate matter, but not even from the toxic gases that accumulate and are an important part of the air pollutants. Especially, we need to go away from our morning walks. This is a time where people think that it's pleasant and to go out for a morning walk may just be good, but we don't realize that because of the smog outside, we're actually damaging ourselves even further.
Right, Mr. Vivek Chattopadhyay, we'd like to find out, this time around the graded response action plan is different from what we've seen previously. It's taking into account also the AQI, not just the concentration of PM 2.5 and PM 10. It's also going to be taking into account the contribution from other pollutants. How different is the graded response action plan going to be this time around? And also when we talk about the farm fire contribution, what we're seeing is it's less this time around. Also, the onset of the pollution season, which comes about with Diwali, is earlier this time around. Usually Diwali happens probably later in October, early November. Also the monsoon withdrawal was delayed. So all these factors that are contributing, have they made a major impact as far as the Diwali pollution is concerned?
Yes, definitely. Meteorological conditions and timing of Diwali definitely matters a lot. And Delhi is particularly vulnerable because according to studies, if you take even throughout the year, half of the year is Delhi witnesses calm conditions, calm wind conditions. So the pollution, whatever happens in the city and that comes to the city from outside, accumulates, and it is not able to dissipate fast. Dispersion is very poor, particularly during the winter time. Ventilation goes down, particularly. Farm fire is definitely a contributing factor, but other consistent sources are, as we know, that vehicles, industries, and other area-wide sources like construction, dust, and other things. So there are several studies have taken place. So now I think the GRAP has been implemented, taking into account the air quality index. So now the focus should also shift to other pollutants too. But the problem with the air quality index, it takes into account only the one prominent pollutant. That is often it is PM 2.5, but the focus should also shift to nitrogen oxides. Nitrogen oxides lead to ozone formation. That is another major pollutant of concern. Then there are air toxics, which are carcinogens mostly, like benzene, toluene, xylene, and other pollutants. So I think we should take a multi-pollutant approach as well as identify different sectors where we need to act fast. Otherwise, health of the citizens is definitely a concern.